This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. The next thing I want to talk about, what are the risks of IVF? Are there any risks? When IVF began, or the first pregnancy was reported in 1978, there were many people, many very, I would say, clever people, scientists and ethicists, and made comments about the fact that this was an experiment that was going to go wrong because we're interfering with nature. We're taking a sperm and an egg and putting them together outside the body. And I suppose there are still a small group of usually religiously driven people who still believe that lack of natural process is a bad thing. There was talk at the time of producing monsters because we were producing we would produce abnormalities. Now around the world there's over 10 million babies born from IVF. There is no monsters. There are no differences between natural conception and IVF in terms of the baby's outcome. They actually are the most studied group of children ever, because people have been obviously concerned about the safety of IVF, their development through their childhood, their development through their teens, and we're now seeing IVF children now having their own children, and most of them are happening naturally. What's been shown is that it is a safe technique. In terms of the actual process and the risks to the woman, there are small risks. There's no question of that, and really no medical treatment, any procedure, whether it be having your knee operated on or whatever, there's always going to be risks of infection. So with IVF, that risk is about 1 in 1,000. So for every 1,000 IVF cycles, there'll be one lady who will need antibiotics afterwards and potentially may end up in hospital, but it is that rare. Because we're putting a needle through the vaginal wall, to some extent, we're under ultrasound control, but there are small blood vessels that you can't see on ultrasound. So there is a tiny risk of bleeding. Again, significant enough to be in hospital, occurs in about 1 in 1,000 egg collections. 999 are going to be absolutely fine, but there is the occasional one where we end up having to do a blood transfusion. They're the two biggest, and they're not very big, acute risks of IVF. In the past, there was another risk, and it still happens occasionally, is overstimulation. So when we give you those drugs to make multiple eggs, some women over-respond. That can lead to very high hormone levels, which after we collect the eggs may lead to some changes in the permeability of blood vessels, so you get fluid collection in your tummy, in your lungs, and very rarely in the brain. That's in its most severe forms. It's called ovarian hyperstimulation syndrome. The good news is that in the last 5 to 10 years, we've worked out a strategy to avoid it, even in women who would otherwise, we'd say, were overstimulated. The way that happens is when we trigger that, when we trigger the final maturation of the eggs, instead of using HCG, which we've been doing since 1978, we now use a different drug, which has the effect of producing the hormones from the pituitary to stimulate the final maturation of the eggs. And that process of stimulating the pituitary prevents ovarian hyperstimulation syndrome. It has the downside in that if we use that drug, we then have to freeze all the embryos. You can't have a fresh transfer because although that's a great natural way of producing that maturation process, what it doesn't do is support the lining of the womb over the next 10 or 15 days. The hormones drop so much that they come away, and the evidence is quite clear that the pregnancy rates are far less if we use that to get out of hyperstimulation syndrome and its complications. We'd end up freezing. The good news, again, is that when we freeze embryos today, the embryo success rate, where the frozen embryo is identical to a fresh one. So the fact that we've had to freeze them all really makes no difference in the long term. The other concerns that have been raised over many years is the concern that the unusual stimulation of the ovaries, that making high estrogen levels, multiple follicles, would that stimulate the risk of cancer? And there are now multiple studies from around the world that says that the overall risk of cancer after IVF is no different, absolutely no different to the background rate of normal pregnancy. We are very, very comfortable saying that the overall risk is no less.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.